In this orthokeratology case, we have a patient who's seeing well after treatment, comfortable with lenses, and the posterior topographies look pretty good. We've got center treatment, and the reverse curve is a little bit broken on the temporal side in each eye, but nothing real significant of concern. And if we look at the lenses that the patient's wearing right now in GSIM view, lens looks really aligned. But just like you described in your case, if we go to the freeform view, in each eye, we see that the lens is not nearly as well aligned as we previously had seen. So of course, freeform view is supposed to be the more actual and accurate representation of the cornea. And the question is whether we ought to design this lens in perhaps freeform mode to get better alignment on the tear graph. And in this case, since the patient is seeing well and the posterior topographies look great, I would not redesign the lens because the goal is to get good vision and a healthy cornea, a happy patient, more so than it is to get a textbook-looking tear graph. This is all theoretical. So why would a lens that looks like it aligns this way work so well on a cornea? And there's probably a few different reasons. There are probably some factors of the cornea that we're not measuring. Perhaps hysteresis has something to do with it. Maybe there are other factors we haven't even identified yet. But it is true, most of the ortho-K world is in an RSIM lens, not even a GSIM lens, and a lot of patients are doing well with those lenses. So even though we're not getting a textbook predicted alignment with our current lens, the fact is it's working well on this patient, and I would probably leave things be. Interestingly enough, WAVE predicts that it's the nasal aspect of each lens where we really don't get any seal at the back edge of the reverse curve, but the topography tells us the opposite, that it's the temporal side that is not sealing off very well. So there are some things I think we just don't know. The posterior topography does help us determine whether or not to make changes for a troubleshoot, but in this case, since the patient does seem to be doing too well in spite of the very unusual looking reverse curve, I would just let the patient be. Perhaps next year when the patient needs to replace lenses, we could redesign freeform and keep the same parameters else otherwise and see what kind of a posterior topography we get at that point. I have done that in certain cases and patients continue to do well, and it does comfort the provider in some places to see a better looking theoretical tear graph. To the patient, they really don't notice any change in the lens or in their post-wear vision. So I think either way, this patient ought to do quite well, and I wouldn't recommend necessarily any changes at this point. So hopefully that's helpful. Continued best luck with your patient, and thanks for watching.